Former President Donald Trump's recent diagnosis has captured headlines and sparked conversations. The news of his chronic venous insufficiency has unexpectedly put a common, yet often misunderstood medical issue in the spotlight, prompting many to wonder about the condition and its implications. His doctors reported observing mild swelling in his lower legs during a routine checkup, but they emphasized that it's a benign and manageable condition, reassuring the public that there's no immediate cause for concern. The public's curiosity surrounding the diagnosis is understandable, given his prominent position, but the real lesson here is that many age-related health issues are incredibly common as we get older and are not always cause for alarm, especially when detected and managed proactively. When doctors observe leg swelling during an examination, they take immediate steps to rule out more serious underlying causes, such as blood clots in the legs or potential heart problems that could be contributing to the swelling. This is achieved through a series of thorough and comprehensive medical testing. In Trump's specific case, the medical tests confirmed that there were no dangerous underlying conditions present, just the presence of chronic venous insufficiency. This situation presents a valuable chance to learn more about a condition that affects millions of individuals worldwide and is often either misunderstood by the general public or simply overlooked during routine checkups. By understanding that this condition can be a normal part of the aging process for many individuals, we can collectively reduce unnecessary anxiety and worry, and instead encourage proactive health checks and open communication with healthcare providers. Ultimately, the focus should be on increasing awareness of the condition and promoting effective management strategies, not succumbing to fear or misinformation. Chronic venous insufficiency, often referred to as CVI, essentially means the veins in your legs are struggling, working harder than they should, to efficiently send blood back up to your heart. This can lead to a backup of blood in the lower extremities. Normally, one-way valves located inside the leg veins work to keep blood moving in a single direction, upward, against gravity, but if these valves become weakened or damaged, blood can begin to pool in the lower legs, causing increased pressure. This pooling of blood leads to swelling, also known as edema, particularly in the ankles and feet, and this condition typically develops gradually over time, often unnoticed at first. Think of it as a plumbing issue in the veins, a problem with the pipes, so to speak, and not a problem originating with the heart itself or the composition of the blood. It's estimated that about 1 in 20 adults experiences this condition, and the risk of developing CVI rises significantly with age. While it's not life-threatening, it can certainly be uncomfortable, causing aching, heaviness, and fatigue in the legs. Understanding what chronic venous insufficiency is helps put the diagnosis in perspective, allowing for informed decisions and reducing unnecessary worry. Most importantly, it's a manageable part of the aging process for many people, and there are effective ways to alleviate the symptoms and improve quality of life. The primary and most noticeable symptom of chronic venous insufficiency is swelling. This swelling typically manifests in the ankles and lower legs. The swelling is often exacerbated, meaning it becomes worse after prolonged periods of standing or sitting. This is due to the increased pressure on the veins in the legs when maintaining these positions for extended durations. Beyond swelling, other signs and symptoms can include a persistent achiness, a feeling of heaviness or fatigue in the legs, frequent cramping, particularly at night, or an uncomfortable itching sensation in the legs. These symptoms can significantly impact daily comfort. Over an extended period, noticeable skin changes may occur. These can include discoloration, often a brownish or reddish hue, or a thickening of the skin, making it feel leathery. In severe and untreated cases, venous ulcers, which are open sores, may develop, typically around the ankles. These ulcers can be painful and slow to heal. Several factors can increase your risk of developing chronic venous insufficiency. These risk factors include increasing age, a family history of the condition, suggesting a genetic predisposition, being overweight or obese, which puts extra pressure on the leg veins, a sedentary lifestyle characterized by prolonged inactivity, and a history of previous blood clots in the legs, which can damage the valves in the veins. Women are statistically more commonly affected by this condition than men, especially following pregnancies, due to the increased blood volume and pressure on the veins during gestation. It's important to remember that despite the potentially uncomfortable symptoms, chronic venous insufficiency is rarely a life-threatening condition. The vast majority of individuals are able to effectively manage their symptoms and maintain a good quality of life through simple lifestyle adjustments. Early recognition of the symptoms and seeking timely consultation with a healthcare professional are crucial steps in managing the condition effectively. With appropriate care and management, the development of serious complications is relatively uncommon. Therefore, this condition should not be a barrier to anyone leading a fulfilling and active life. With the right approach, you can continue to enjoy your favorite activities and maintain your overall well-being. Diagnosis starts with a physical exam and a review of symptoms and medical history. Doctors look for swelling, skin changes, and varicose veins, and ask about risk factors. The main test is a Doppler ultrasound, which shows how blood flows through the leg veins and checks if valves are working. Blood tests may rule out other causes like heart or kidney problems. In Trump's case, ultrasounds confirmed the diagnosis and ruled out blood clots. These steps are standard for anyone with leg swelling. The process is straightforward and ensures the right treatment plan. Accurate diagnosis brings peace of mind and guides effective care. The good news is chronic venous insufficiency is highly manageable. Key strategies include elevating the legs, regular walking, and wearing compression stockings to support blood flow. Compression stockings are a simple, effective tool for reducing swelling and discomfort. Medications like diuretics or blood thinners may be used in some cases, but most people don't need them. Minor procedures or surgeries are reserved for severe cases. For most, lifestyle changes and compression are enough. Trump's doctors report he's symptom-free and in good health. The diagnosis is not a cause for alarm, just something to manage. With the right approach, people can stay active and healthy. Awareness and early action make all the difference.